Public awareness of psychological problems in Pakistan. Mental health literacy is defined as knowledge of and beliefs about mental disorders. It further includes the ability of laymen to recognize mental disorders and to be aware of its possible treatment. Awareness of psychological problems or familiarity with mental disorders and its treatment helps a person to overcome the stigma and get treated. Poor mental health literacy has been considered a global problem. Several researchers have studied the rates of mental health literacy globally. Apart from the prevalence of several mental disorders found in Pakistan by Dr. Sukoon, no earlier studies were conducted which could provide detailed information on the level of mental health literacy in the country. The WHO AIMS report on mental health systems in Pakistan provided information of the existing mental health policies and facilities in the country, hence did not assess mental health literacy among the public. Kausar measured mental health literacy in Pakistan, yet the findings of her study were only limited to depression and psychosis. Furnham and Hamid conducted a review on mental health literacy in non-Western countries. They mentioned studies conducted in Iran, India, China, and some other countries, hence they also could not find any study on mental health literacy in Pakistan. This sensitized Dr. Sukoon to conduct a study to explore the latest state of public awareness of psychological problems in the country. He analyzed the awareness of public about psychological problems and the possible ways of treatment. An innovative dimension of that study was not asking the public about their awareness of mental disorders through psychiatric labels as mentioned in the Diagnostic and Statistical Manual of Mental Disorders. The study assumed that even a well-educated Pakistani could not be aware of the mental disorders in psychiatric terminologies. Awareness of the problematic nature of a specific disorder can, however, be analyzed if asked through common symptoms in the daily used language. Moreover, it becomes the responsibility of the mental health practitioners to guide people about the exact disorders they are suffering from. The study by Dr. Sukoon involved 3,500 conveniently selected Pakistanis from different major cities. The sample was highly diversified based on gender, age, marital status, education, income, and other important socio-demographic factors. A detailed research questionnaire was developed in Urdu to gather the required data. The questionnaire comprised of a checklist to measure the respondents' awareness of different mental disorders and psychological problems. It was assumed that the respondents would be unable to identify psychological problems under those labels which are mentioned in the Diagnostic and Statistical Manual of Mental Disorders. The common disorders, therefore, were retitled in a more understandable way to ease the respondents so that their knowledge about different negative mental states could be measured. The Urdu translations for stress, nervousness, fatigue, boredom, irritation, aggression, fear, anxiety, discomfort, sadness, hopelessness, problems in sleep, relational problems, disturbance in routine, loneliness, migraine, sexual weakness, sexual dissatisfaction, madness, and intellectual disability were used in the questionnaire. A part of the questionnaire also consisted of an open-ended question to measure the respondents' awareness of the possible ways of treating psychological problems. The findings revealed that only 36% of the respondents were aware of the psychological problems overall. The most known psychological problem was stress, and the least known psychological problem was sexual weakness. Females had significantly more awareness of stress, fatigue, fear, problems in sleep, loneliness, migraine, and madness as compared to males. Males had significantly more awareness of boredom as compared to females. Several earlier studies conducted in other parts of the world have also revealed that most people don't possess the desired or satisfactory levels of mental health literacy. Studies have also discovered that mental health literacy rates are lower in Asian cultures as compared with the Western ones. Some global studies have also found that women have higher mental health literacy as compared to men. The respondents of Dr. Sukoon's study were also asked about their awareness of the possible ways of treating psychological problems. In response, 6 possible ways of treating psychological problems were mentioned by the respondents. 42.17% were aware about psychotherapy as a way of treatment for psychological problems, followed by their awareness of social support 17.29%, medicine 6.74%, supernatural practices 6.29%, religious practices 5.60%, and self-help 3.57% as possible ways to treat psychological problems. Help seeking for psychological problems can be formal and informal. Instead of the proven benefits of psychological counseling and psychotherapy, people usually consider to take help from informal sources, for example family members and friends. However, when the psychological problems get severe, both psychotherapy and medicine have been viewed as possible and reliable options by the public. Apart from the professional psychological support, informal help or social support does also have proven positive effects on mental health, which makes people consider it a possible way of handling psychological problems. Social network, furthermore, has a very important role on one's help-seeking decisions as well. The help-seeking decisions of a person also vary with age, and informal help occurs more in younger age groups. In Indian and Pakistani cultures, many people prefer to consult with traditional healers due to their beliefs in supernatural forces. Religious practices are also considered effective possible means for many people to overcome psychological problems. Certain cultural barriers also hinder in seeking psychological help in Pakistan. The aforesaid study by Dr. Sukoon revealed that people in Pakistan did not have the satisfactory knowledge to consider several symptoms as problems of mental health in nature. Lack of information on mental disorders would hinder in the proper treatment and will spoil the overall psychosocial environment of the country. There is a dire need to raise awareness on mental health in the country. The study sensitizes all the stakeholders such as mental health practitioners, clinical psychologists, psychiatrists, and Ministry of Health to play their positive roles in this regard. The practicing mental health professionals such as clinical psychologists and psychiatrists should raise public awareness on mental health related issues by being often active on social media. They should author short essays in public interest and send this information through print and electronic media. They can also give free of charge lectures on different platforms from time to time. The Ministry of Health in the country needs to be more active to raise public awareness on psychological issues. It can distribute proper funds to conduct such activities by involving the practicing mental health professionals. Thanks for listening. To read the entire paper, kindly visit www.drsakoon.info.